Today's series of Docplexus KOL interviews, we have with us Dr. Mohan Thomas. Dr. Mohan Thomas is an American-trained and board-certified cosmetic surgeon now practicing in India. His area of expertise relates to cosmetic surgery. He's a chief surgeon and medical director of the Cosmetic Surgery Institute Private Limited, Mumbai. He's a recipient of Award of Excellence in Cosmetic Surgery and Skin Clinic by Times Health, Award of Excellence in Cosmetic Surgery by the American Academy of Cosmetic Surgery, and Rajiv Gandhi Award for Excellence. He has several publications in international journals. Thank you, Dr. Mohan Thomas, for the interview.
You're welcome.
Doctor, is the biodegradable filler hyaluronic acid a permanent solution for lip augmentation?
Well, hyaluronic acid is a biocompatible, biodegradable filler material which has the closest resemblance to normal tissues. The fact that it is not permanent is a good thing because nothing that is biodegradable and biocompatible can ever be permanent. All permanent fillings or fillers in the past have resulted in permanent problems. There was a filler material out there which was using basically PMMC, which was left behind in the lip, and it went on to cause multiple abscesses in the lip. So while one may have to deal with the semi-permanent nature of lip fillers, it represents, and to this day, the gold standard and a safe product for use in the lip.
Are there any safer alternatives for Botox? What are the recent advancements?
Botox is botulism toxin A. It is a neuromodulator, which means in simple English, if you have a wrinkle, it blocks the wrinkle by preventing transmission between the cells. This is a temporary measure. Depending on the site, it can last anywhere from a few weeks to 4 to 6 months. There is no antidote to Botox, which means once you block it, it remains blocked. So in some ways, it's a blessing in disguise that let's say somebody's face was blocked permanently. That would be a very bad thing, particularly if something went amiss. So while it is temporary in nature, again, it represents a safe product. The patient has the latitude of either going on with treatment or stopping it anytime they need.
What is the difference between liposuction, 4D liposuction, and mega liposuction?
Well, liposuction is a surgical procedure wherein one extracts fat in a designated area. Men are apples, women are pears. So the body shape will change. So these areas are marked, and these are areas that are resistant to diet and exercise. A plain liposuction is just extracting some amount of fat from a designated area that the patient chooses to. The doctor and the patient decide on the area, and it gets done under local anesthesia. Tumescent liposuction is what is considered to be safe and most popular. 4D is a high definition form of liposuction, and certainly that is for the people that have discerning bodies. Let's say bodybuilders who want a six-pack or something, that would be a 4D liposuction. Mega liposuction, as the name suggests, is mega. Large amounts of fat are extracted from various areas. Mega liposuction can sometimes be a mega problem because there's a certain risk involved. And these procedures, up to 5 liters, is done in a hospital setting, or rather, up to 5 liters is done in an outpatient office setting, and anything more than 5 liters is done in a hospital setting. I wrote the safety standards for mega liposuction, strategies for safe management of mega liposuction patients in the British Journal of Plastic and Reconstructive Surgery.
Some recent clinical studies suggest that breast implants are linked to cancer. How big is that a risk?
Well, about 3 or 4 years ago, there were a few cases wherein patients seemed to have a sort of lymphoma called large cell lymphoma. which was loosely associated with placement of implants. However, as we stand today as a body of surgeons, recognized surgeons across the globe, we feel that in certain individuals, there may be a risk, in having this large cell lymphomas, but the incidence is so low. And if you were to judge by the number of implants being done on a day-to-day basis, there has been no reduction in the number of implants being done. As a matter of fact, it is going up in a very healthy manner. While the concerns are there and the discussion is entertained, there's no real alarm clocks that has to go off now, saying that, oh my God, we shouldn't be doing breast implants because you're going to get large cell lymphoma. I mean, so if we were to just summarize, if you look at all the benefits, risks, and options that breast implants provide females wanting such enhancements, the risk remains small, and it's a risk that is discussed.
How can doctors use platform like Docplexus to gain medical information?
Well, I think the internet highway is here to stay. People are now referring to various portals, whether it be Wikipedia or our own, the Cosmetic Surgery and Skin Institute. We have a website. People are using that as a portal as well. It gives people a chance to kind of ask the frequently asked questions, the answers, and when they come in to have a discussion with the doctor, they have some basic information, the question they may want to pose, either based on what they have read, plus their own concerns or concerns they may have regarding the procedure and the safety thereof. One is concerned about short-term risks as well as long-term risks. And so a platform, even Docplexus, could be such a portal where patients could aware themselves of information prior to undergoing a procedure.
So, doctor, is there anything out there for lay people to refer to and understand cosmetic surgery?
A few years ago, the Times of India group approached me to write such a book for lay people on cosmetic medicine and surgery. I thought it was a worthwhile endeavor, and so I obliged, and we came out with a book called Picture Perfect. It's basically authored by me, and it goes into the benefits, risks, and options of the most commonly done cosmetic medicine and surgery procedures, so the patient can refer to it. I have not put on any glossy pictures in it,
Yeah.
but very simple schematic pictures so that any person with a non-medical background can read and understand, and then go to the doctor before they consult with them and get a fairly good understanding of what is that they're getting into.
Thank you so much, doctor, for your time.
You're welcome.
It was a pleasure having you here.
Likewise.